Welcome back to the EAU podcast series on what young urologists need to know. This is segment 2, where we discuss the balance of life of young urologists. In this fourth and last episode of this segment, we are joined by Francesco Montorsi, a director of the urology department of the San Raffaele Hospital in Milan, also a professor of urology and director of the urology residency program of the Vita Salute San Raffaele University of Milan, Italy, and Dr. Laura Mertens, oncologic urologist at Netherlands Cancer Institute in Amsterdam. Together, they will discuss effective time management for busy urologists. Join us as we embark on this informative journey.
Hello, everyone. Welcome to the next episode of our podcast series. Professor Montorsi, thank you so much for joining us today.
I am delighted to be here with you and all our listeners.
Great. You are undoubtedly a busy urologist. To start, could you guide us through a typical week in your professional life? What does it look like?
Waking up very early in the morning, I think there are no secrets against that. So if you are not an early bird, then probably you have chosen the wrong specialty. So waking up extremely early, in general, we are all at the hospital at the latest at 7 in the morning, usually earlier than that. And the very early time of the day is devoted to see the patients that have been done the day before, and then typically at least what is regarding myself. The morning goes devoted to the operating theater until more or less 1 o'clock, 2 o'clock. In between cases, I'm seeing patients. And then typically lunchtime is actually devoted to do correspondence, academic things, taking care of the department. In our system, private practice has an important role, and I devote time to that in the afternoon. They are typically long days, starting very early in the morning, and I am usually back home at night at no earlier than 8 o'clock.
And you said you're an early bird. What time do you usually get up?
I have my wake-up call at 5:30.
5:30.
Yes, and then when at the beginning of my career, I was able to do everything, which means taking a shower and shaving, etc., in 30 minutes and be up and running. Now I need more time, which is at least 50 minutes or so. So I would typically wake up at that time, and then out I drive my smart car, and typically I would go from my home. I live in the center of Milan, to San Raffaele, which is located on the loop surrounding the city, so that it would take 20 minutes at that time. And that's why I'm there very early. And it's nice to be there early because there are fewer people around, so you have time to sit down, do your own things.
So then it's patient care, lunch, management skills, and private practice. When do you do your research?
Well, the research is done 24 hours a day because it is done every minute. I have the luck to have a large number of excellent people working with me. And our department is really an academic department. And what I mean is that is devoted to learning. So reading everything which is published in the literature, discussing what has been published, and comparing that results to ours, so that we spend our time, we're all together in the group, either it is in the OR or it is rounding patients or having morning discussions that obviously are scheduled during the week, which means morbidity and mortality, journal clubs, discussion of our own results. But I don't have a specific time which is devoted to that, because once again, it is there at all times. But I must confess that when I go for vacation and I am at the beach, my real vacation and real relax is sunbathing on the beach and reading papers. And that is the timing where I write my letters to the editors, because I become usually frustrated or angry for something that I have read, which I think is not right. So I would use my smartphone, write the letter to the editor like a WhatsApp, send it to one of my guys who are wonderful in finalizing the letter, and then the thing is gone. That's how I spend my vacation time.
But that's funny, because probably on vacation, you finally have the time to reflect on things and just, without distraction, work on these aspects, don't you think?
Well, yeah, yes, and that's true. But that is something that I did not decide myself. So when you are reading papers, you can either find them boring, and clearly you immediately understand if the paper is a boring one, which is not leaving anything with you, so I would throw it away. But many times papers are very interesting and you do learn a lot. And this is something that I always tell my younger collaborations, read and read and read and read, because you get the good ideas for your future research. And that I find is extremely relaxing, number one, and it is feeding up my curiosity. And if you don't have curiosity, you're living a sad life. And I was always extremely lucky and having the opportunity to ask myself questions and try to find good answers.
So you have to be an early bird and a curious one, right?
Those are two ingredients, yes.
Let's just focus on your early career. Can you maybe share with the audience an anecdote from your early days as a urologist when you struggled with time management and how you found a solution that really worked for you? Is there a secret?
The secret I have is that my mentor, my boss, Professor Rigatti, was even a much more early bird than myself. So he would never sleep. And I remember at the time when there were no cell phones, I would still live in my family with my parents. I think I was like 25 years of age, 26. But in the place of my parents and myself, we had two telephone lines. So one was the line used by my parents, and the other one was the line used by myself, and it was in my bedroom. So it was quite often that I would receive a phone call from Professor Rigatti at 4:30 in the morning or so, and he would ask me, "Are you still sleeping?" And my reaction would be, of course not. I have been waking up for hours and doing things, which was not true. But so the secret was that in a way or in the other, I was taught also to be an early bird. And this is to say that there are no secrets. You must be ready in liking the idea of having very long days. If you don't like that, it totally makes sense. But then you choose to live a different life.
And how did you manage to combine such a huge professional life with being an early bird and also having a personal life yourself? How's that possible?
I was extremely lucky in meeting 35 years ago my current wife, Alessandra, who is an extremely intelligent lady. We met and we got married 10 months later, our first meeting. And probably one of the ingredients of our happiness, then we have had two beautiful girls, our daughters, and I think I can certainly say that we are a wonderful family, very happy, all of us.
Mm-hmm.
I presume that both of us maintained our own spaces. My wife has her own space also with her girlfriends, and I have mine. I am a passionate of wine, for example. So 3 or 4 times per year, I take a few days with a very restricted group of friends I have, whom I have had over the years. And so we will go visit cellars and do things like that. So probably the secret has one of the ingredients of the secret has been that one. But I must confess that I have a wonderful personal life. I consider myself a privileged person.
So you've been enjoying family life, personal life, and professional life as much as possible. No concession.
Absolutely, yes, 100%.
I was just wondering, because with so many tasks to do during a day, prioritizing must be extremely important. What strategies do you find most effective in prioritizing tasks? How do you decide what to tackle first, for example?
Well, I think that it really depends. Well, clearly, our job is important.
Yeah.
It really depends on what is needed to make your day, in a way. So, what I mean is that at our place, clinical practice is indeed important. I work in a private university and hospital where we are expected as chief of the unit to reach the targets that the administration has assigned us at the beginning of the year. So it's not like completely public service. So clearly, the clinical practice is important from that standpoint. So obviously, being a surgeon, what is requested to me is to be available and do patients in the operating theater. Patients are referred to myself, those who decided to be managed by me, which means that then I have at the end the final responsibility of those patients. And altogether, that is indeed the most important aspect of my job. That being said, also the entire issue of research, the research I do personally is mostly clinical research. So it is based on what we do with patients. And as I said, it is done 24 hours a day, I would tend to say. The organization is one day is very similar to the other. I can change my diary myself according to the things I need to do. So it is myself who is choosing, I want to attend that congress, I want to attend that meeting because I think it is important for my education. And I do not have to ask an authorization from the hospital. I am completely free. They would look at would be the final result from all the perspectives at the end of the year. And that is indeed something which is extremely important. But also within my group, we try our best to give the opportunity to everyone to fulfill his expectations. And I have always been a strong believer of giving everyone the opportunity to go learning also outside. This is what is a very significant peculiarity of our residency program, for example, which is lasting 5 years. And we are supporting all the most talented residents that we have from all the points of view, finding the connections, the money to do things, and they spend quite a long time abroad in top-level institutions to improve their education.
So you're actually trying to stimulate talented young people by means of funding opportunities abroad. Is that correct?
Oh, yes. Oh, yes. Oh, yes. Okay. I want all my staff, including those who are really on staff and those who are on staff, but they are residents. I don't want any of them to have a problem with money at the end of the month. Because I want them to be relaxed, to do their things, to be happy. And so we do all we can, and they are all involved in the private practice, for example, that we do. If you want to send somebody to New York City to spend a year with Professor Vickers, the epidemiologist, we have been doing that for the last 10 years now. New York City is a very expensive city. Then we agreed together with Memorial that I would pay a salary, they would pay a salary to have one of my residents being with them every year. So the financial issue must not be a problem. And that is indeed a responsibility of the chief.
Yeah.
My younger residents and fellows have other responsibilities in terms of research. At this moment in time, they are those who are writing the papers. My years, my most productive years in writing papers started in 1987, 88, and finished in the year 2001, 2002. And then following that year, I started more and more looking at the papers written by the others, helping them in optimizing the papers. And that lasted for another 10 years. And then finally, I have lucky enough to have those working with me who have been doing that supervision on the scientific activity while I am indeed providing my input. I try to give new ideas to explore. But certainly, I am not requested to make final revisions on manuscripts because there are many in my unit which are much better than myself in doing so today.
Yeah, but they can take advantage of your experience, of course, in reviewing the papers.
Well, yes, but I remember, just to tell you an anecdote, I remember when I made the revisions of the first scientific article written in first person by Professor Briganti, the current editor-in-chief of European Urology.
Yeah.
Alberto has been a medical student with me since he was 23. And we met in the classroom. I was giving a talk and he was listening to me as a student. And then he decided to have his graduation thesis with me.
Yes.
Remember that he was the one who carried over the study that was published in European Urology, and it is still today one of the most cited papers that we have, the one correlating erectile dysfunction as an harbinger, as an early spy of ischemic heart disease. So Albi started like that. He did his medical graduation with me, then a resident, then a fellow, then on staff, now full professor, now editor-in-chief of European Urology. His first article that he wrote himself was on the sexual complications following HOLEPS for BPH. And I remember that the paper went back and forth 15 times between myself and himself, until at the very end it was a good paper, and it was accepted and published in the Journal of Urology, that one. So now Albi is the editor-in-chief of the top journal in our specialty, as you know. So those are excellent, beautiful memories that I will bring with me forever.
Don't you think that's a great example of mentorship, how mentorship goes or should go, actually?
Yes, but if I may say one thing, which I always quote, is that those who are lucky enough to have a mentor, they should also be good enough to learn from the mistakes which are made by the mentor. So being a mentor does not mean to do everything right. You make your own mistakes.
And what was your own mistake then?
Oh, I think that whenever they are spending a day with me, they probably see me making 1,000 of mistakes every day. And that's why they are so good, because they learn a lot. So I'm somebody who has the responsibility of training younger people, should not consider himself being the king on a throne, because we teach by example. Being there early in the morning, how you talk to patients, being curious and reading the literature, continuing to ask yourself questions which can be of interest of everybody else, suggest areas of research. Those are things which are indeed very helpful.
Professor Montorsi, I'm just really interested. What would be your biggest mistake when it comes to time management?
Well, probably every day, one should consider prioritizing everything you have in front of you. And for example, you have 15 different piles of paperwork that you have to do on your table, and pulling together administrative issues, patient issues, etc. One should always take his time initially to look at everything real fast, understand what should be done first and what should be done the last. And so start with the most important thing. But you know what? Sometimes the most important thing is also the one which is requesting you to invest more energy, thinking about brain energy, intellectual energy. Sometimes I am just too exhausted, and I would say, let's start with the easy ones, and then I will keep the most difficult one for the end. I'm not sure that is a good decision. And so if one wanted to be extremely scientific in how to approach things, he should have always this initial part when looking at everything he has to do, and then decide which goes first and which goes second, and so on and so forth. That I'm not sure I was always able to do so.
And it's not always a matter of only prioritizing and then do first what needs to be done first. But indeed, as you say, you also have to find the energy to do certain tasks.
Well, it is true, but it is part of our day. So I'm not sure that there are jobs where things that you're supposed to be doing are always number one, in your opinion, in your consideration. But that is the job that has to be done, and that is the job that has to be done. Probably my best memories I have were my personal years as editor-in-chief of European Urology from 2006 to 2014. because there at that time, I would really live 24 hours a day thinking about the journal and doing things. But I was able to do so because I did not consider that a job. That was a passion. That I always thought I am so fortunate that I was given this opportunity to do things in the area which I like most.
Because there must have been a big time pressure there.
Yes, but again, if you wake up in the morning very early and as soon as you wake up, you have your computer on and you watch the website of the journal to see what papers have come in, and then you take your first decisions. You move things moving forward.
Mm-hmm.
And you do it every minute you can, in between cases, in between things, in between patients' visits. Then you do a little bit every time, but you do it 1,000 times per day. And that is keeping your day very full. And I think that that was one of the secrets of the success of the journal. And by being always connected, we also had the opportunity to maintain our brain as active as ever. And that's why we had so many new ideas, and we did transfer the journal, I think, completely. That was the basis of the success of European Urology at that time.
And that's how you worked as an editor-in-chief, just do it the first thing in the morning and then many times again during the day.
Very often colleagues would ask me, how much time are you devoting to the journal? My answer would be 24 hours a day. But I see that Professor Briganti is exactly doing the same thing. Nowadays, he has always the journal in his mind. But that is the only way you can be successful, because you must change the course of the journal. One of the things I have always tried to teach my trainees has been, if you think that everything is all right in whatever you're doing, then it is time to change completely. Because otherwise it means that you are sitting down on your good results and you think that you cannot improve. So I learned that lesson with the journal, and so often I would talk to the other editors saying, we are doing great, so what we should do now to further improve? And our impact factor was escalating up like a rocket at that time. But still, we did want to change things very often. And that paid us back very nicely.
So you have to remain innovative.
Yes, absolutely.
I would like to focus a little bit on distraction, because in a fast-paced environment like yours, interruptions are obviously common. I mean, you find yourself writing a grant proposal in the hospital, and then you're interrupting patient inquiries, or you're doing patient care, and then emails about research projects flood in. Not a huge problem, but they can detract from efficiency. How do you effectively minimize distractions and maintain focus on your priorities?
Listen, this is an excellent question. I said it earlier on, the very early minutes when I get to the hospital. Number one, I have my mind is completely fresh, and I have always been much more productive very early in the morning than late in the evening.
Mm-hmm.
So that is when I can defend my time. But unfortunately, in my position today, I cannot just lock the door of my office and tell everyone, don't talk to me. I just cannot. The responsibilities are so huge that so interruptions are there. And I am afraid that this is the same experience that many top people have. Indeed, you must give credit to those working with you. And whenever a project has to be done and developed and completed, identify somebody who has the responsibility to follow it. And usually you obtain two results. Number one, you make the person you have identified happy, because clearly that is a testimony of trust that you have on that specific person. So you are asking him or her, I trust you a lot. We have to do this. Please follow this new initiative. And then you cannot make everything by yourself. That is just a matter of time. So that whenever I am involved in something to be done, or I have a new idea, the second step would be to think who can be with me in doing this initiative, who can be helping me. And then we create a small working group. That I like to do especially with young residents. When I see patients in my private office in the afternoon, I have always one of my residents with me because they are learning a lot on how to approach a patient, how questions to make, etc. But then if we have an idea together while being there, my immediate question would be, would you be happy in being involved in this? Do you think that this idea is of interest? Would you be happy to follow this protocol? And mostly the answers would be very enthusiastic, and they would say, yes, of course. So let me understand what I should do. So give them responsibilities.
It's about teamwork.
Make them feeling to be part of a team, yes, and then pay them back, because we just had the meeting in Paris, and we were a group of more or less 40 people from San Raffaele. Everybody who had an abstract accepted was given the opportunity to go, and we did cover the expenses. And so they could have the opportunity to attend the meeting, learn a lot, improve their education, but also be present, show up themselves, so that they were the ones presenting the abstract. And we are going to do the same also for San Antonio at the AUA. We will be probably an even larger group.
Yeah, I think teamwork can be beneficial for many, many reasons, but also within the perspective of time management. What I also thought was really interesting is that you said, of course, I cannot just close the door and avoid any distractions. Just to specify this a little bit, do you, for example, just turn off your phone sometimes, or do you listen to specific music to focus a little bit?
No, listen, my phone is always on the silent mode. But that does not mean that I don't take phone calls. But as a rule, I take phone calls only from numbers that I know, that I have already recorded on my phone. And because I know who I'm going to talk to. Otherwise, I have a number of excellent administrative assistants who know that they have to check the numbers who called me, and they have to call them back to see what's up. And by doing so, I also avoid so many phone calls which are just for advertisement and from people trying to sell you something. So I don't want to waste my time in doing so. For music, I love music. What I do when I am finally in bed in the evening, I typically would spend, I just cannot lay down in my bed and switch off the light. I must do something. And so typically I would watch YouTube short videos on the things which make me relax.
Really?
And the first topic would be golden retrievers, the dogs. I have a beautiful golden retriever. His name is Romeo. He is 5.5 years now. And as I said, I had 2 daughters and I love both of them immensely. But Romeo is my boy, is my kid. And whenever I go back home in the evening, he's the first one to show up and saying hello to me. And when I walk out the dog in the evening, Romeo in the evening, that is one of the best time of my days, because I relax and I talk to him. So if people look at me seeing that gentleman talking to a dog, probably they will think that I am crazy. But that is part of a very intense relationship that I have with Romeo. So that I watch YouTube videos on golden retrievers usually.
Okay, and no specific music for you?
No, I very much like pop music. And so there are some singers which I like very much, both Italian and international. We have season tickets for the La Scala Opera House, so that I try to go as many times as I can to the opera evenings at La Scala with my wife. Mm-hmm. So I do like that, indeed. But yes, during the day, I must confess that I don't have too much time to listen to music. For example, when I drive my car, typically it would be early in the morning from home to the hospital, then in the afternoon from the hospital to my office, which is downtown Milan. And then in the evening to go out for dinner, which I do very often, or going back home. Then I would listen to a radio program, which would be information in the very early morning. So it is a kind of, it's a very nice program, which is devoted to news and analysis of the news. So that's interesting. first part of the afternoon, at that time, I would typically listen to a program which is on sport, which then they are covering what is the most interesting thing on that specific day. And then in the evening, at the end of my office, there is a program. It is always on the same radio. The radio is always the same, which is entertainment, with two journalists who are excellent. And I laugh a lot while listening to them. So I have these three different timings during the day, which altogether would be 20 minutes, 30 minutes, 20 minutes, more or less. I enjoy that very much.
So despite the tight schedule, still some time for relaxation with the dog and the radio.
Oh, yes. Oh, yes.
Let's continue with unexpected situations, because no matter how well you obviously plan, things sometimes just don't go according to plan. Can you maybe share an instance where things did not go as expected, putting your time management skills to test? Do you have an example for us?
Unfortunately, yes. And the first thing that comes to mind is when I am abroad for, typically it would be a meeting. And when flying back, there are issues with the air flight. And when I come back home, especially if I am in the US, etc., it means that the next day I have a full schedule in my OR. And if something goes wrong, that goes to hell. But then I learned the lesson that everything that seems a catastrophe, at the end it is not, because patients can wait 24 hours, and I would do the case the following day. There are many things which seem outrageously important, and you miss the opportunity to complete those tasks, and you think life will never be like it was. That is totally unrealistic. It is not true. So one has to learn to dominate his emotions. Last AUA, it happened the very same thing. I didn't miss my flight, but my flight was canceled when it was very difficult flying over the States. So I found a beautiful hotel in the city. I slept there one day. The following morning, I did relax a little bit, and then I took the same flight next day. And clearly they had to move my patients to the following day, but at the end, nothing really bad happened.
So you just stay calm and try to accept the situation as it is, and then find a solution.
Well, exactly. If there is nothing that you can do, you have to accept what is happening.
If you cannot change it, there's nothing else you can do.
Live with it, yes.
I have another question for you, because we've just been discussing about the different tasks people get to do in their career or during their professional life. You obviously also get many requests to review things, to help, to serve an advisory board, another board. Can you recall a situation where you opted to decline a request? And then I mean a situation where in fact it was really difficult to decline, but where you thought it would be better to decline for the sake of time management?
You learn by experience. I have stopped accepting invitation to advisory boards 15 years ago. And because I took the decision that whatever compensation I could receive would never equal to what I would do at the hospital, university, and things. So that it was a decision that I took myself. So I have not worked with a pharma company for the last 15 years. I have excellent relationship with them, of course, but I think it is just time consuming.
Yeah.
So that is something that I would never do. Indeed, with regards to scientific meetings, I must confess that I have not attended a national scientific meeting for the last 4 or 5 years. I know that the meetings I want to be for my education and my job are the EAU meeting, the AUA meeting, the meeting of an American association which is called the genitourinary surgeons, of which I have the privilege to be a member. And then it could well be that there are minor meetings related to one of these three organizations. Take the meeting of the EROS section of the EAU. I do robotics at all times, so I try to attend that meeting. But indeed, now I have become pretty good in declining an invitation which is done a year in advance. And I tell the guy the truth. I tell the one who is inviting me, I tell the truth. I'm just saying, I can't do it. because I know that if I accept, I will be in troubles when it comes to attend the meeting and so on and so forth. So probably I am feeling, I am causing some disappointment.
And actually, it's pretty smart. If you just tell them you're afraid it's going to be too much or if you're going to be in trouble, then you're not going to disappoint anyone.
Yeah, and I try to be as kind, as polite as possible, and I explain my views. So most of the people would understand. At the end of the day, I don't think that I develop any type of enemies by doing so. I have just been just very open and correct to everybody. I have, in my group nowadays, many collaborators who are still very young, but they are so popular, so important, so famous. They are invited everywhere. And I understand that they are happy to go where they are invited. And it makes sense. But that is because they are of that age group. So I would do the same at that age, at my time, in my position. So I just tell them, please do consider that although it appears to be beautiful, you cannot just say yes to every single invitation you receive, because at the end of the day, you will be wasting time.
Yeah.
So priority, and priority. Some of them have been listening to my recommendation, but some others not. and I can only make a recommendation or a suggestion if it is requested, by the way. But then they are all grown-up people and they decide what they want to do.
But it sounds like an important recommendation or an important advice. Reflecting on your experience, do you have any other advices you would give to a young urologist struggling with time management, except of prioritizing and waking up early, of course?
Not really, I have to say. Our life is tough. Our life is very difficult, and also you have to be able to compromise, because probably no one of us is able to do everything at 100% of the energy. And many times I tell young people, young urologists I talk to, it makes a lot of sense to decide that I want to be at the office at 8 o'clock, and so at a decent time in the morning. I know that I will be done at 4 o'clock. By doing so, it is an 8 hour per day regimen, which is totally normal, I think. Then I can go back home and I pick up my kids at school at 4:30, and I have the entire afternoon, second part of the afternoon, to spend with my family or do other things. How can somebody say that that is wrong? It is not.
Yeah.
It is just a decision. You like that type of lifestyle? That's fine. That's totally fine. Many urologists, when they receive the final recognition of the entire course of studies and they became board certified urologists, they decided to go work somewhere else. And I always help them to find a good position, so they would not stay with me here at San Raffaele. And I have to say that all of them, whenever I bounce in them and we meet at meetings, etc., they are happy because they have found the good location. Perhaps they are in a very tiny hospital in the community. They do their life. They are excellent with patients, but then they don't have to be there at 6 o'clock in the morning. They don't have the pressure to write 15 papers during a year. That pressure is here at San Raffaele. It's a very competitive, but at the same time, friendly environment. But indeed, it is competitive. And because at the end of the year, we know, for example, who has published what. That is right there. These are the figures that define the members of the unit. So is this correct? I don't know, but this is what it is at San Raffaele. I'm not saying that this is the way to go. And if you like it, then you are in the best place. If you don't like it, then you will find a place which is giving you less pressure.
So it's a choice you make to pursue a certain career.
Exactly. We live in a free world. I mean, this is one of the things that we still have. No one is obliging us to do different.
Oh, that's true. I believe, Professor Montorsi, that we have discussed quite a lot. Discussed challenges in early career stages, prioritizing, distraction, unexpected situations. Do you have any final remarks to add?
That I was delighted to have this chat with you. And that I hope that what we said will be of interest for those who are listening, and that the doors of San Raffaele are always open to anyone who wants to come over and visit. And we would be delighted to host anyone who wants to show up.
I would also like to express my great gratitude to you, Professor Montorsi, for this conversation, for your valuable insights.
Oh, come on. Thank you. Thank you so much.
Wake up early, have a fresh mind, invest in your family. Teamwork makes the dream work. And also a big thanks, of course, to the listeners.
Thank you very much. Have a nice day.
Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. Make sure to stay tuned and don't miss out on segment 3 of our series, What Young Urologists Need to Know, as we will delve into the essential topic of pursuing academic excellence in urology. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.